I'd like to call the meeting to order. All stand for the pledge, please. I
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
I wanted to start the meeting with a thank you to Mr. Broadwell, Mr. Castelia, Heather Milford, who has not made it, and Margaret.
Thank you, sir.
Morris and I were the only two surviving members of the Health Committee, if we both get reappointed to this committee. But thank you for your service,
Oh, yeah.
your commitment and comments and assistance with the growth of the Health Department and making things healthier for the county. And ladies and gentlemen, have been phenomenal committee to work with. I really enjoyed doing this.
I've been on it since, I've been here 11 years on this committee, so. Were you on it?
What'd you do? Goof up one year and not get on it?
Yeah. 11 years, that's when we had health and human services together. Were you on it at that time too? So you've been there also.
Yeah.
But you're also on the state level down there, so
Yeah.
keep going. Yeah, very important at my SAC. So I don't know about Frank, when did you get on this, Frank?
I was off for 1 year. They removed me 1 year. Yeah. So it's been 5 years.
You've been on it all that time too, all 11 years too?
Oh, not 11 years.
It's only 21.
That's true. It's only 21.
Anyway, thank you for your service to this committee.
You're welcome. Thank you,
It's been
sir.
rewarding. Need a motion for the approval of the minutes, please?
I'll make it.
Second, Peter? Second, all in favor? Aye. Opposed? We have one resolution today, and there was I don't know if it was a miscommunication but anyway, it said on the original, that the Health Department asked the Health Committee and Legislature to accept the Central New York Community Foundation donation to the Health and Families Program. And you now have a revision. So there was a mistake in printing that. And so we'll need to amend the resolution.
I'm supposed to try to find the mistake? Is this kind of
Well,
like
find
how many dots or look alike or something?
I said Rural Health Network in one of the.
In the original one, if you printed it off, says rural health.
You waiting for a motion?
Yeah.
Oh, I'll make that motion.
Yeah, the original says rural health.
Second.
Yeah.
Second.
The health department.
So then, that's for the amendment?
Oh, amendment first?
That's
Okay,
the amendment.
amendment first, okay, yeah.
All right, give me a second. All in favor, say aye.
Aye.
Opposed? All right. Now we can, need a motion for the resolution, and then we can discuss it.
I'll make that too.
Okay. Have a second? Is there any discussion? Do you want to explain your resolution real quick?
Oh, I give it to Chantel.
We applied for a grant a few years back from the Community Foundation and were awarded that grant, a small one. And then for the last 2 years, they've actually donated $250 back to us. So we're appreciative of that.
Big money today,
Yeah,
because that's the only resolution we're accepting $250.
this is the foundation, second time, right? Give to us the money for health and families program.
Okay, all in favor, say aye.
Aye.
Opposed? Motion carries. So Chantel, you're up first with team Trauma Informed.
Jane had asked me to come back and talk about where our collaborative is at. Unfortunately, he's not here, but hope you will all appreciate what I have to share. We've made a lot of progress since we started. So our original trauma informed care training collaborative learning opportunity started with a grant that we applied for our Healthy Families Program. And with that funding, we were able to partner with integrated community planning to, instead of training one person in trauma informed care for the county, to train at least 30. So we embarked on a fun journey to train some staff at the health department, and I believe there were 19 agencies total with 30 original participants that went through the collaborative, and we met via conference calls and in person over the 7-month period. After that training wrapped up, we decided, based on the training and the needs of all the organizations that we were working with, that we wanted to continue that work group and grow it so that we could share the information that we had attained and then make some universal changes, things that were consistent across the county. So the sheet that you have there just explains where we've come to from the beginning. We have met consistently. We've been meeting on a monthly basis since July, and we did some strategic planning. We created a vision, mission, and developed some core values. And we broke out into 3 subcommittees to work on an awareness campaign, building the collaborative participation, and then what education and training would look like for agencies across the county.
Okay, let's stop you there for a second. I need to ask the committee question. Shane is on his way, and he's the one that requested this. Do you want to go to director's report and then have you?
Do you mind?
Okay with you? All right, so let's switch and have you give your report.
Okay,
You want me to pass those on?
okay, give my report.
want me
Thank you,
to-
Vera.
You're welcome.
But he's on his way.
Okay.
I was mid-rec.
My report here, and the first is my about the disease report. And as you know, we have,
Oh, yes.
and as you know, we have hepatitis A outbreak, and we announced about a month ago. And actually, the first report, now we go back, and it's in early June. And here, each underneath is bi-weekly, and June 2nd week we had the first case. And then in the middle and end of October, we realized this is something in a special group of population, and it's a cluster. And here you can see the blue one are special populations, and the orange one are general population. And so we can see most of the cases is on this special population. And
Now, what's the special population as opposed to the original?
special population we talk about is drug user and homeless.
Okay,
And so this is a cluster among these people, and it's an outbreak. The reason we say this is an outbreak is because every year in the past 10 years, we usually have 0 to 3 cases. And now this situation is well above our normal situation. So the week ended before Thanksgiving, and after Thanksgiving, we got 2 more cases. So this situation seems not ending, and it's not ending, and we are still working on it. And comparatively, it look like it's going down. And Onondaga County, their case keep growing, keep coming. So we are better than other county, but still, it's not the end. Since I want to say since September Yes, our department preventive put a lot of resources to combat this outbreak. And we have weekly, this is really a very good collaboration within the government and within the community. And we have our weekly clinic at Farnham because we said that these special populations, they use it. And these drug user, and we set up a clinic by every week and deliver shots to them. And several dozen of shots already delivered. And also we have a clinic at the Coco, I think also weekly. And we have clinic at the Safe Harbor, also because they're human homeless, and we reach out to DSS, and we went to the hotel, motels, DSS place homeless there and give them shots. And overall, we give more than 100 doses of hepatitis A so far. And it's really, it's a bigger struggle for us. The reason is because so many times we are wasted. The reason is because this population, they are not openly step up to say, yes, who's my close contact, and it's very, very difficult. They give you wrong information, they disguise you to different people, and the investigation is very laborious. But our preventive team did do a great job. And this is hepatitis A situation. And since this state work with us, and we reach out to community, reach out to this special population, and we reach out to all permitted uh, food service facilities, restaurants, school, cafeterias like these. And we want to prevent this because the disease is passed through fecal oral. So we want to prevent contaminated food distributed in the community. And another thing we did is we reach out to ACR, and I think 2 years ago they came. It's a regional drug treatment and free needle exchange program cover Oswego County, and we reach out to them, and because we have very, very difficult to reach out to this population. And their feedback is in Oswego County, about 300 residents go to Syracuse to get free needle exchange. And we are working with them, and we hope to find when they are open, and we can ask them to pass our information to these drug users. So this is still in the working, and this on this side is really the difficult to reach out to this population. And this is hepatitis A.
Is there any particular age that's really getting it, like teenagers more than adults, or
No.
adults more than?
Age is about from 24 to 45 age
Oh,
group.
so it's wide range.
No, wide range probably from like, yes, early 20s to 58 years old range. But most they are at 24 to 45.
Are the non-cluster population cases, are you able to figure out where they've contracted it as well? Is it really from food service facilities, or?
No, some we identify, some we cannot identify. For example, yes, we do identify airline attendee, and she flew back from a European country. Yeah, and a couple case we can identified. And another case, I think probably yes, she came back from California. So we identified at that time, they, they contacted the virus.
Hmm.
Yeah. This really, disease investigation is a very labor intense work. And our team is really, does a great job.
Second question, what finally makes them come forward to get their shot if they need a shot? Do they get so sick they can't work or?
No, get shots is not a, you, when you develop symptoms, no, usually we don't give shots. And this, the shots is given to their close contacts.
Okay,
Yeah, like even like our this sheriff department, their staff, we give them shots.
okay,
And the inmates, we give them shots. The reason is because in our jail facility, a group of inmates, they use same bathroom.
Mhm.
So they stay there, so we consider all of them, they are in close contacts. Outside, yes, your family member, your roommates, and we consider close contacts. And give shots only to close contacts if they exposure the case less than 2 weeks. If more than 2 weeks, usually, no, it's not recommended to give shots for prevention.
so if they're sick and got it, what
Yeah.
makes them come forward?
Makes them come forward is more, they develop symptoms. They feel tired, they develop jaundice, and yeah, their stomach not comfortable, they feel sick. This, they move forward. Yeah. And also, yes, we reach out to all primary care physicians in the county and ask them when they find the suspect case, refer to us for early investigation.
Not good.
And this is hepatitis A, and flu situation, and we're in the flu season, and the flu case is in increased trend now, and yes, a flu level is escalated, and the flu season usually we have 5 levels: non-activity, local activity, regional activity, widespread, or sporadic. Non-activity, sporadic, local, regional, and widespread. And now we escalated to regional. So cases increasing, but the good thing is really, this I also want to mention preventive, and the preventive already give more than 100 dose of flu vaccine. In the past, since I came here, almost 7 years, and in the past season, usually the whole season we give 700, 800 doses. Last year was the most, we give close to 1,000 doses. And this year, still we have 4 months of go out of flu season, already give more than 1,000 doses. Wow. So this is a flu situation. And the vaping is a bigger things, and really, yes, Vera now leads the team to address drug issues, and also include the vaping and suicide prevention, more mental health. And vaping in our county, I look at just about the new data from the state, and in our county, already investigated 4 cases of vaping-related lung injuries. This is a new disease definition, and the whole state is about 200 cases. In our county, probably less than 4 cases. But this is still under working, and our target is young population, especially middle school, high school students, and we we're working with Oswego School District, and we try to go to other school districts.
Last month, I think we asked the question about, I guess your response was the state hadn't given you the directive about how to maybe react, or I don't want to say police it, or how you're gonna manage that as they were restricting certain things. Have you received that information from the state about how the counties are supposed to act, about the policy change within the state about vaping? Flavors and all those things that nobody's supposed to have, is anybody, and
Yes, flavors, yes, the governor tried to ban the flavor, but it got legal challenge and it's still not settled yet. And as a health department, yes, I think it just follow the whole state rule and not give us how to do it. But we feel this bigger concern is really high school, middle school kids, and over these years, their conventional tobacco use reduced, but their use of e-cigarettes is like 4 times than 2014. So we focus on this population. And another challenge is really, yes, this is sure, it's a national data. And about a third of parents cannot identify it's a regular thumb driver for computer or it's a e-cigarette. And a tenth of educators cannot identify it. So that's why when I talk about the school really, we are not just try to work with students, it's more focused on parents and educators. Okay. Yeah, this is my disease report and department activity review. I will pause here and let Chantel do hers. Then we'll go back to slides. Okay.
Chantel was presenting and we heard you were coming, so we switched gears.
thank you very much.
So we're talking about trauma informed care. You asked last time I was here, did you get the handout? Our collaborative formed after the training that we, 30 of us participated in, that was presented by the University of Buffalo. And we've been meeting consistently every month since July. We've done some strategic planning. We've developed a vision, a mission, and core values. And we've broken out into 3 subcommittees. We have one group working on an awareness campaign, doing a boilerplate statement, like an elevator speech that we can all use anytime we encounter questions about what it is or how we do it. We're all, so that we're all on the same page. We're working on also building the participation in the collaborative. Right now we have 14 agencies that are participating. We started with, I believe, 19. It's kind of ebb and flow. We've lost contact with Liberty Resources, but we've also had a sort of kind of probation join the group. And we'll continue to work to grow that as we continue to meet. We're also working on education and training. We have a group putting together a PowerPoint, which we're going to actually see for the first time as our internal group. We'll be doing that on the 19th at City Voices location in Phoenix, and give back our feedback and what we'd like to see, any changes or anything like that. And then we hope to roll that training out, level 1 training, by March of this coming year. So that training will be for frontline staff and anybody that's working with our direct care providers and administration as well. And then we'll go on to level 2, which we've not developed, and then level 3, depending on what the need is.
I have a question. On the trauma part, the word trauma, Are we talking physical trauma, emotional trauma, or mental trauma, or what kind of a trauma are you talking about in here?
We're talking about all
All
forms
three
of
of them,
trauma.
and whatever more there is, so. There's other traumas because, you get hurt in a car accident or you have somebody die, emotionally you're very upset and all that, so all of that,
Yes.
the whole thing.
Typically, people hear the word trauma and they think, like somebody's been in a car accident or they've been hurt in some way. And yes, this is, has a tendency to be more emotional
Yep.
type, how people respond to it and how we interact with people on a daily basis.
Yes, thank you. I kind of thought that when I was looking at the stuff here.
So that's where we're at right now. We've set a long-term goal to try to build our trainings up to level 3 and to continue to meet on a monthly basis and see where we end up. We'd like to look for some additional funding. We do have, if you look at your handout there, there's a logo in the back. The watermark. That, created for us by city, which I thought was very nice. Everyone seems to be on board with that. So if you see that, that's us. And if you have any ideas of people that you think we might include, that would be helpful. I think it's important to have.
Is there, another question, is there, I see that there's Catholic charities there, but is there any other church groups that you
There is
can
not.
work with? Are they not interested in it, or you haven't approached them? Because there's a lot of things in here that these people can help by going to their church. If their minister has the background that he needs to have, or she.
Absolutely. We actually have them on our list of people to contact, and we have someone working on it, I believe Tammy Thompson.
So that's something
That's
down the
one,
road
yep.
to try to get them onto the list
Yep.
here.
Yep, absolutely. And that's one, like I said, one of our committees is working on building participation in our collaborative. So that's a target group.
As it was explained to me a while back, the trauma, early impacts create long-term issues. I guess I'm wondering, thinking about that, how many people have exposure to the kids, right? So to see issues or things like that, meaning, I guess the schools would probably be, and other than really seeing city BOCES, if we try to wrap our arms around the superintendent's groups and really, educate them to what this initiative is.
Yep, actually Stu Amell
Stu.
is on our group, and he did our strategic planning piece. And we've been contacted by Oswego City School District to provide some training at potentially one of their days where they do staff education, to work with the teachers and administrative staff to give them kind of the background. They've gotten a lot of information about how to recognize things with children, but they haven't gotten information about how to handle the emotional trauma that they have themselves. So that's where we're at with that right now.
Just to follow up, the only reason I say I think that'd be great is important because I see a lot more of that collaborative where you have caseworkers, from the Department of Social Services integrated in some of the school districts, so they have that communication right to, kind of like the home office with what's going on with the family, then with what's going on in the school, which a lot of them don't have, or that's gaining on that. So I think you connect that link between the two, which could help out in that situation. So I'm glad to hear the school. I think the schools are going to be a key to be educated about what this is. I mean, when we had a meeting here and brought in all of these parties to say, what's the big initiative? This was the big initiative that was born out of these groups that said trauma-informed care. And most people sitting around the table, including me, were like, what is that? And I've somewhat been plugged in for a few years, so I hope the schools get their hands, embrace it. Thank you.
Yeah, actually, Shane, that was exactly my point too. I was going to talk about the schools and I'm trying to understand the organization of what you're doing. Because you have the tiers of training. Do you see administration from the school districts coming into those trainings and then going back, or you discussed actually pushing program with their superintendent's days, their staff training days? Who would that fall on your shoulders? Like, who would be the educators that go? Do each one of these organizations have educators now that can go and do the training? Is that the goal?
So that actually is the goal, that the people that participate in the training that we provide will be able to then bring that back to their organization. So they will have that, like I'm not sure that I would be comfortable going into a school, but I would certainly be comfortable going to a medical facility to talk about what someone might encounter. So our
It would
hope
be-
is,
I'm sorry, I don't mean to interrupt.
well, our hope is to get, more agencies involved so that everyone gets trained in the basic trauma-informed approach, and then they can tailor that to their organization.
So you would want the administration to some degree being involved at this level, or they would come to the levels of training and then take it back, or you would have, because it's only, like Shane pointed out, City BOCES is the only education-based program listed, so they would be the ones to do the pushing program then, because that's their forte is education?
Yeah, I would say yes. They're already kind of working on that, Kate, Guinea, and Sue as well. I'm trying to bring it to the school. They're doing some forms of things that fall in that area, like mindfulness, and so the hope is that they will kind of take the school route. Right now, we've reached out to Patrick Wallace from the Oswego High School to get him to come to the meeting, but I'm not so sure that he would be the one to actually do the training at the school.
Right.
And I think we would have more of a team approach if we were to do that on, like an educational day,
Okay.
rather than just one person going in to talk about it.
I'm just trying to figure out how to
Yeah.
help you because I definitely, like Shane suggested, there's a lot of buy-in right now and people want the tools, and teachers specifically need them, but obviously they don't have the time or the flexibility to attend training, but if it can come to them on a day that's already scheduled, then that's fantastic. So if there's any way I can help you facilitate that, I'd be happy to.
Thank you. Yeah, we're still trying to work out exactly how it's gonna roll out, which is why we need to have as many people on board as possible so we can get input on how to, to set it up, to design it, what needs to be included, what can be left out, where we should hold training if we were to do, have people come to us, or, just really what it'll look like. So, yes, I would definitely be reaching out.
Just quickly for the presentation you have on the 19th at the City BOCES, what time does that start? And is that a training or is that a, like a one-on-one or what exactly?
That's our group, that's our regularly scheduled meeting.
Okay.
And so us as a collaborative are going to actually participate in the training that will be presented by City BOCES. So we can get a feel for what it actually is, and then when we are able to share training, questions about the training, we'll be able to say, this is what the training does. I participated in it myself, and so we can speak to it.
Would you like to have any legislators there so we can bring it back?
Absolutely.
So what time does that start? Or I can get with you offline and you can tell me. Thanks, that's it.
Okay, Margaret?
Yeah, thank you, sir. Back in my other life, I taught GED to students to get a high school diploma. Now, one of the biggest things that they did not understand, they could read and write a little bit, they had no idea how to budget their money. And so every time they get a little bit of money, they go spend it. If you buy a car, they don't understand, you gotta pay the payments, then you gotta buy the insurance for it, so they lose the car. So I think one of the things on your people here that you wanna add to your list would be budgeting or some kind of thing, so they understand that you're gonna lose your house if you spend all your money and you can't pay the house payment, and you can't pay the taxes. Once we got them to understand they had to budget, these are grown-up people, GED people, you have to budget your money, what you got, and you can only spend what you can spend unless you're gonna lose this, this, and this. And I would think that would help a little bit on some of your trauma. Because people, they want this house to go buy the house, but now you gotta fix it up. You gotta pay the taxes on it, you gotta pay the monthly payment. If you get behind, you gotta pay the interest on it. Now they lose their house. So I think that would be one more thing to add to your classes that they're gonna have to have, is they got to work with what they've got. earn more, and you'll be surprised. And I couldn't get over how many adults had no clue about how to budget. But that's in my other life.
Jake,
I don't know how they're doing now.
Can you, touch on what you talked about, looking for funding, like at all, or like, do you have a goal, or, we've come in recently, you came in with a multi-year plan for something, does this have a multi-year plan? Well, you got a few people in here that have been here for a while, like, where does it go, I guess, from here? You know what I mean, in the is there a thought about how much money you're talking about looking for funding?
At this point, we have not developed an idea of what we would need for funding. You know, something as simple as a logo, which would cost us a lot of money, we have done for free by City BOCES. I don't think at this point we really know what that looks like. And as I said, we've had our short-term goals were to develop those 3 subcommittees to work on just building awareness. And then I think once we meet, you know, the next few meetings, we'll talk more about what exactly we need, like if we need to, you know, money for printing or supplies or, I don't know, something that we might give out at a training to help or, you know, things along that line. So I think in the future, we'll look to developing a funding plan. At this point, we don't have that.
I add a little bit to what Chantal said, and she already mentioned that, yes, want to educate everybody. Here, the key word I think is the everybody. And we tried, go back a year, 2 years ago, and we say we want to adopt trauma-informed care, and the idea is really build a trauma-informed community, and Chantal leads the group and modified, want to build Oswego County a trauma-resilient community. This really, the key here is educate everybody. And so I look at it, in the near future, the cost is education and training. And really, we need to have a program soon. And how soon follow Chantal leads the group and get some, in our county, get some people, bring from, not far away, from University of Buffalo, have a train the trainer train. And so in our county, yes, human services, health, at that time, I hope we can include the hospital. I hope we can include law enforcement, and sure, definitely school, and several school. Let's get more than a handful of people. They are trainers, like Chantal said, yes, she's comfortable go to health institute. So we need the people talk to law enforcement. We need the people to talk to school. We need the people talk to social services. So train these trainers and spread the message. This is the cost I look forward.
Sorry, I gotta continue here. I guess I just want to back up because we sat down 2 years ago and said, let's get all of the people together, put all of the lists on the wall that were the lowest ranking items, right? And then we kind of said, what are the items on that we want to start to put our hands around that hit many of those buttons? Out of many of those meetings, this was the most important thing that everybody came out with. So to go back in time a bit, when we started talking about anti-poverty conversations, the school district, so when we went and sat with the superintendents and said, we need you on board, that was a first. I mean, you had a 3-way partnership between all of the school districts chipped in, even though it was a stipend, like $5,000 or less, then the county and then the Shinneman Foundation was there because it was that kind of a collaborative. I don't know how you do it from here, but it has to be promoted like this was the biggest item in front of everybody as far as focusing on what the major priority is. And you may need to go back and start to get somebody to say, let's get the superintendents back in the room, because born out of all these other conversations is this is the number one thing, and here's what we need you on board with. I'm just saying, I don't know how you get to the level of exposure that you need without doing that and getting all. And the only reason I love Stu O'Malley, he's fantastic, he's had great success on the east end of the county. Very small schools. And when I talked to, at that time, we had a lot of bigger principals at the table that left Oswego, went out there and said, wow, what a totally different vibe though. Those smaller schools compared to Oswego City School District, totally different vibe. You've got to get the two largest school districts on board, Oswego, Fulton, and then the Central Square and the others. So you can really turn this into something big. I don't know how that happens, but it'd be great to kind of go back in time and explain to everybody, this is the priority coming out of the county, not just by the county, but because of all of these meetings and these groups involved. So, I wish you luck because I hope it's successful.
Yeah, this actually, it's a good point, is really, Chantel now try to, her group try to increase the awareness, because still, we don't have enough awareness. Like, yes, a very good, question or comments, what's the definition of trauma? Trauma, yes, here, we talk about trauma is not a physical trauma. At the individual level, trauma is a person, he had adverse events and imprinted him, and he's stressed and impacted his coping system. He cannot get out of this mental shadow. But trauma is also a social trauma. The social trauma is really, it interrupts interpersonal relationship. It interfere community development, because we talk about education. Because I think I forwarded it to you. And the CDC's last month, their research, and the child early events impacted people's education attainment, affected people's income. So this interrupted community development. And also this, I think, yes, in our county, we heard so many so-called generational poverty. It's historically harmed the community. So the trauma at the individual level, at the society level, we need to let people know. Because so far, at least I feel, people still think trauma-informed is your business, it's not my business. Because you talk about socio-economic, you talk about domestic violence. I'm a nurse, I'm a physician, and it's not. No, it's yours. It's your physicians. It's yours. It's your policemen's. Because police, yes, it's a first responder with the domestic violence. So like this, we needed to let them know, not just know, also we need to let them, like Chantal said, everybody learn. And it's not go to ask people why you do that. Instead, understanding them and have a common ground. So we need to increase, still we need to increase community awareness at some point, yes. We need to educate school, we need to educate all school staff, we need to educate most of clinicians, and also include the police like this.
Well, I just wanted to reinforce the train the trainers concept. I think you're going to, that's going to pay back benefits for sure. Because you really need that, what you just described, that understanding, that level of understanding, like existing inside school districts, in the counselor's offices, in the classrooms. And so I think that you're on the right direction there when it comes to that. I think small school districts, with all due respect, it's a little bit easier to implement programming than larger school districts. You're talking about changing entire cultures.
Absolutely.
So I'm excited about the future of this, and I actually think you're doing it in the right way by making sure all your ducks are in a row and you're really comprehensive in your approach. So
Thank you.
Any other comment? Thank you. You're back on.
My turn, okay. I just want to take this opportunity and briefly review our recent department activity, and I'm talking about the recent, probably recent 2-3 years or a little bit longer. And I know next year, 5 of 7 are leaving, and I take this opportunity to give you a brief review and continue. I hope even you are away, we still will have opportunity to working together. Okay, and this is the first one. We had Super Dirt Week for 4 years, started 2016, and this is the first one. This Jeff is a. Oh, sorry. Yes, I have. No. Oh, you okay? This is the first Jeff. He is the program promoter, and he sent a thank you note to our new environment health director. This is the first time, and really very nice. And he said yes, without you they cannot do it. It's really
Nice.
and this Super Dirt Week you can see 2016, and they have only this dark gray area parking lot. Sure, they park a car at that time everywhere, but it's even at this parking lot, they don't have electricity, they don't have water. And started after 2016, yes, they put electricity there, they put water there. And the biggest thing change is really, this picture came from 2016. And you can see these RV getting so close, it's a safety risk. So that's why our environment health work very hard every year, work with them. And this is sure, probably I said it to Judy, our new director. This is our department shortcoming. Everything fine, we don't take a picture. Everything's not well, we take a picture. So I cannot show you how they arrange it. But now, yes, it's safe, and if anything happens, emergency vehicle, ambulance, or fire engine can go into them. So, but on this side, yes, there's this parking space surrounding there, and now they well solid ground and well defined. So this is really achievement in the past 4 years. Another thing I want to thank you, and this was a picture from 2017, and we had flood in the county, and the flood affected the business, affected the residents, and also wash some shoreline away. And yes, you are all from local, and we work with
Me.
yeah, you, yes, and Sandy Creek and Mexico and other towns, and our environment health distributed information, and also provided the vaccine, and clean up kits, and it's a very good success collaboration with your support. And this is really a team, flooded team. In our internally, it's a great collaboration. We have health educator here, and we have preventive staff here, and the rest is environmental health. And it's a really bring the team together and work well. And another thing I want to thank you is really, this triple E every year is an endemic disease for our community, especially at the so close to this swampy area. And over these years, and you're very supportive, and everything goes so smooth, and especially I still remember, I want to say thanks to Phil was, yes, when I just step on the first few cases, and he always timely give me advice, give me support. And now, less and less, but this means I'm growing, right? Thank you, Phil. And this is an aeroplane, and Mr. Doflo's aeroplane, and you can see the chemical is sprayed behind it. This is one of the best.
In addition to your plane that's spraying this, there's something new coming in, the drones. Drones have arrived,
Yeah.
so to speak. For most people, the drones have come, of course, from Griffiths, the New Airs, which is the development organization for drones. But we have locally a drone person on board in the Fulton Mall that is now Empire Drones. And they're equipped with these drones that have a tank, about 25 gallons of water, and they can spray certain small areas. I don't know what the state rules and regulations and all this stuff is about, but that ideal little drone or drone of that nature, you know, say if there's 10 houses here, could be done with a little drone. And the gentleman is down there in the Fulton Mall. He just started up his business. John McGraw is the name. I'm not here to advertise him, but I'm advertising a situation where we can handle insect control more smaller, in smaller units, and help that situation possibly.
Okay, so this in environmental health and what's next? Our next is hospice, and this is about 3 years ago, Vera, right? And when Vera was the hospice program, and yes, our hospice program over these years and reduce the cost. And to go back, really, I want to thanks to the health committee and the timely to close the chart in the long term and focus our attention to strengthen hospice program. And under Vera's leadership, a hospice program turned red to black, and now every year we see our cost reduced and our volume increased, and our quality especially, you can see. I don't know why. I copy paste and not a picture here, and this was from a newspaper.
That's all right, you got the AD. You got visas too.
So, so this is really, yes, your help, your direction, and we have a strong hospice program and your favorite program.
We said it at that time, you know, that if you put something into it, you'll get back out of it.
Yeah.
You can't just let it say, well, we can't do anything. You know,
Yeah.
and I want to thank you guys for doing what you did. You guys, really, it's something to be proud of, all of us. We were on the committee at that time, and your group. Thank you.
No, thank you.
And this, very briefly, this slide try to put the county overall health advances. And yeah, I'm not going to read through this slides, and you have the slides you can see, and a lot of numbers. And the key here, I want to say is really over these years and your direction, collaboration, and this is really many things. Now we go out to talk with other agency in the government system or outside the agency, and yes, they're used to it and they are willing to put their hands on. Just like this Chantal just presented, the trauma-informed collaborative started with our department and integrated community planning. And we put money there, they put money there, not enough money, grant from Western and Central New York Health Foundation supported. So this is a handy example and the collaboration. Another is really, yes, you see, just last year, yes, just this year, not end of year, and we are lifted at the bottom. None of our health indicator in the ranking is at the bottom 3. But I'm still now closer to March, and I become more nervous. I don't know what's next year. March will report. But anyway, yes, things will go up and down. But anyway, we are at the right direction.
I just have to comment here, and it's, and people look at that and they say, well, the health department can't be, and it's not the health department that is the biggest factor here. It's the unemployment and the poverty is what puts the health department where it is as far as the rankings go, because without jobs, you have people that really don't, the last thing they're thinking about is going to a doctor or getting a shot or doing the right thing. They're looking to buy something to eat and not worrying about it. So it's not so much as any failure on the health department's part. It's the part of we need to get, our economy back up to where it used to be. And then the health department, as well as you guys are performing, is gonna skyrocket up to the top. And that's the only reason why the other counties are ahead of us is because they have the jobs, they have the people that are working, and they don't have the poverty level that we have. I always cringe when people say, well, yeah, but it's not the health department. It's not that. They're giving us the report. That's all they're doing. Okay, and they can't do any better than what they are because we don't have the jobs for them. So that's all. I'm sorry. That's it.
Thank you, Mr. Castori. Yes, I take this as a commended. And but on this side is really we look at the reason we look at it so hard is because we believe in our community as a community we need to build a culture of health. Everybody value his or her own health, and our whole community work together. That's why we bring this trauma-informed care and the hope, because health is not just a health issue. Health is really social issue, as you said. It's job, it's salary, it's housing. So we, as health department, we can bring people's attention and bring people working together. That's under your direction, what we are doing. And what's the slide? Oh, this is a healthy highway program, highway program, and this pilot published and healthy highway. Yes, after this pilot and now promoted to the whole county. And this, yes, thank you for your support and Ms. Broadwell, yes, you brought these 3 parties together, and now this was only 2 schools, and now we are working at all 24 elementary schools in the county. And yes, this week we'll discuss how to analyze this new data, and yes, I will keep you posted. And yeah, this is a tobacco cessation program, and we got the national recognition. This is a model practice. It happened last year, and Vera went there and they got a plate back. And so this really related to social issue is tobacco is affected the most socio-economically disadvantaged population. And this approach really helped them and helped them to quit smoking. And our data here, yeah, I think you can show these are smoking among smoking women with public insurance. This is smoking with private insurance. These women, they are enrolled into program with public insurance and with private insurance. So we help more socially disadvantaged women, because yes, we have so many health issues there, but health burden is different. Different socioeconomic status and bear different burden and more burden on disadvantaged population. So this program helps them. And this is, yes, how we can build up. Another, our shining spot in our department is this emergency preparedness and the cookie drill. It's a famous cookie drill. When I talk about the cookie drill, people always, oh wow, cookie drill, yes. And you can see this department, highway department, yes, they help us. And we work with local Girl Scouts team, and this, yes, presented at the national conference. So I'm not going to talk any because Chantal already presented, and this is her core team here, okay? And you see, this is from Youth Bureau and from integrated community planning, our department, and our early intervention, our education, our preventive, and where's Chantel? Oh, Chantel's here, right? And also some other outside social services agencies and the DSS. Okay. So this is look forward. We have our health challenges, and our health challenges, yes, still go back if limited to health indicators, obesity, smoking, and disease include communicable disease and also include mosquito tick-borne disease, all at an increase. And our suicide rates is high, and our drug abuse is high, and the STD, we saw its increase, but still lower than state average, and we're slower, and this is, but the bigger issue here, yes, I already touched the health disparity associated with socioeconomic status. And the bigger issue is really our limited department funding. Most of them goes to unfunded and underfunded state and federal requirement. This is a big issue because we calculated and 70% of our funding county government gave to our department goes to early intervention. Early intervention is a state mandate. And the other about close to 10% fill the state mandates. So this is the challenge. Oh yeah, major factor of challenge, and I already touched it here. And other challenge is really we are a rural county and rural nature, and you can see we're geographically isolated. This, yes, make people more attended, long winter sit there and isolated, smoking, nothing to do. And local resources, yes, mostly go to unfunded and underfunded mandate programs. So yes, thank you for your support, and we were not so successful, but at least we are applied for the Coach of Health and got Robert Wood Johnson's recognition, and they gave us some very detailed feedback. They gave us, I reported it to you, and I think I shared the letter to you here. I highlight here what we need to do is really, yes, we need to encourage policy change, and we need to look at the economic development, and we need to bring non-traditional agency business into our health improvement. And most exciting and the most recent achievement, and thanks to our preventive and this is a letter from State Health Department, and is that we got a $41,000 award for our immunization program. And this award letter, and we haven't get any paperwork, so we didn't bring for your approval to accept the money. And this is seventh year, and since 2013, this is the seventh year. And in the past 6 years, or 7 years, we got 6 award, and almost every time we were successful. The only time we lost it was because State Department measure HIV STD treatment. HIV STD treatment is not, it's our business, but not we control it. We contract the other agency in the county to do it, so we fail. The rest, we all got some money. I remember probably at least we got $5,000, and the maximum probably 2 years ago, we got $42,000 at that time, preventive and the environment jointly got the money. So this is the most recent, and I want to say thanks to all your support, and let me finish my presentation with this one of my favorite quotation from Henry Ford. And I hope we can remain working together and make Oswego County healthier and also give me less trouble. And yes, anytime, call me, email me, and thank you. That's all.
Thank you.
Okay, one final update, thanks to Mr. Church working diligently with me, complaining the accessible doors on the county health building. The equipment is in, the wiring is not completed yet.
It's already complete our building.
No, we checked this morning, they're not working yet.
I checked it because.
I checked it the other day,
Yeah.
but it will get done, and it looks like it'll be done this year, so that's a great step forward, because, as you just heard, vaccinations are continuing to rise, so people that have mobility issues, families with strollers, and they use the clinic, this will be much, much easier for them to have access to that. So thank you, Mr. Church, for taking that challenge on.
Thank you.
Thank you.
We thank you too. It was very much needed.
I was the complainer, he was the implementer. Is there any other comments? Once again, thank you, people that are serving on the committee. We lose the whole committee except for the old dog's still here.
We're gonna have any entertainment.
He can sit on the outside anytime. he
Wish
wants
all
to
you
come
guys
out.
the best.
I need the
Thank
appropriate
you.
motion, please.
I won't.
I'll make it.
Frank.
Who on you, Frank?
Well, I gotta go back to do the other job, but,
All in favor?
Aye.
I'll say no.